Hey, everybody, we'll get started in a few minutes. We have another group joining, so I'm just going to give everybody a minute to get logged in. How's everybody today? Welcome to week 5. Y'all doing
Good. How are
okay?
you?
Good. So make sure that you're logged in with your name. So when I do attendance, we can,
You said, how are we doing? I'm tripping out because we're walking into week 5, which means there's only a month left. There's only 4 weeks left. That's it. And I'm tripping out.
well, don't trip out. It's going to be okay.
Don't worry, you're not alone.
Isn't it such like a surreal, like scary feeling to think about? Like it's exciting, but it's also like super scary.
It is. I'm sure it is. You think about it like school is your protection, right? And so now it's coming towards the end and we're getting close to the end and you're like, I gotta finish up school and then pass my NCLEX and get a job. Yep, school is kind of like your protection. So we still have some coming in. So every I know it's this time it's super stressful. I understand that as we get towards the end of the term. So, just take a deep breath. I know this, stress is going to be something that unfortunately, right, you can't do anything about it. It's just how we kind of get through it. But yeah, I mean, you guys are doing great. Just keep the momentum going. We still have a few more.
Are we taking the quiz now? I
We
can't
can't
hear
hear
you.
you. Sorry, I just wanted to make sure that all of Dr. Tenfed's group got the message to log in. All right. So quiz 5. So for Dr. Tenz's group, there's no password for it. So you should be able to log in and take your quiz. For my group, I will put the password in the chat as soon as I get there. All right. You have 15 minutes. It's 10 questions. We'll just start class at 3. So you can turn your cameras on after the quiz and we'll start class at 3. All right. So good job, everybody, on the quiz. Um, People popping in and out. Does anybody have any questions about the quiz?
The one question, the select all that apply, I believe it was like number 8. I'm assuming it was 3 answers.
Let me look.
I saw that too. I thought it was 3 answers too, but it told me only to pick 2, so I only picked 2, but I thought there were 3 answers there.
You said number 8.
Yes. Was it 3 or 4 answers?
Number 8 said one, some, or all may be correct. So there were 3 answers.
I know which 2 for sure, and then I was stuck between what were the answer choices. There were 2 that was very obvious, and then the last one, are you able to say the 3?
Yeah, so it was the gunshot injury,
Mm-hmm. The
the
depression.
right, and then developing hives after receiving a tetanus injection.
Okay, so we're saying like report it as in because it's an allergic reaction. Is that why?
Correct. So
Okay.
because it's an adverse reaction to a vaccine, we need to report it because they do
To
keep
to
track of
who?
those.
To the
Um,
hospital or to the like
they
the question
do-
didn't specify, so that's why I was like I wasn't too sure. So I was stuck between the 2 and 3, but I wasn't. I mean 3 and 4 questions choices, but
So there's a actual vaccine reporting where you would report it to.
okay, got it. Thank
And
you.
some you also may need to report it to the health department. It just
Okay.
But yeah,
Thank
any
you.
adverse reactions to vaccines are reported because they do keep track of those, for those, odd, reactions that some people may have. So they do monitor, much like when they, put medications on the on the market, even aftermarket, they will monitor any adverse reactions. So those are reported as well. Any other questions? All right, well, welcome to Dr. Tenz's class. Thanks everybody for joining. I'm glad everybody got the message. So this week is all about delegation. Um, and so as future nurses, as future practical nurses, in some situations, depending on where you are working, you will be leaders, think about even in community in long-term care, in some community settings, you guys can be hired as leaders. And so it's really important that you develop your management skills, your leadership skills, so that you can direct and supervise others that are going to be working with you. So, what do we know about delegation? Let's start with that. What do we know about delegation?
You have to be able to delegate to the right task to the right person and make sure that they know, like it's in their scope, and make sure they know how to do it correctly.
Very good. You have to know who you're delegating to, what you're delegating, all of that wonderful stuff.
We
So
have to make sure that it's the right, that we're delegating the right task
yes,
under the right circumstance in the situation,
very good. Awesome. Very good. I am going to share my
and make sure
screen.
they're qualified to do it.
Exactly. And how do we know if they're qualified to do it?
Watching them demonstrate the tasks.
Okay, so
complete-
we can watch them demonstrate the task, but what do we have to know first? What is our
If it's in their
overarching,
scope,
I'm sorry?
if it's in their scope of practice.
Very good. If it's within their scope of practice, right? So we need to know, according to the Nurse Practice Act or NAPNES, right, what we can do. So we know delegating is necessary, right? There's no way as a nurse we can do it all, right? We're not one man show. Very rarely will we ever, be alone on a unit. And so the goal of delegation, right, is to, spread it out. I like the way she wrote, multiply yourself. It saves time, but it also help to develop the competency, the capability of your team, as well as the individual team members. So as you are looking, and all of those rights of delegation are absolutely correct. You hit the nail on the head with those. But again, importantly, we also need to know what that State Nurse Practice Act is. So who are some of the people that we will delegate to?
UAPs.
Are UAPs, right? And so UAPs, nursing assistants, they also may, in some areas, you may see some medication aides, um, patient care tags or care partners, depending in the organization that you are working with or working in. And so, exactly, you're going to be responsible for supervising them and making sure that they do what you ask them to do. So why might you be hesitant to delegate? And so I enjoy what I do. I don't want to sacrifice the work. No one else can do it as well as I can. It might make me look bad if someone does a better job than me. I don't want to burden people. It'll be easier to do it myself, right? The company expects me to do this since I'm the expert. I don't want to jeopardize my position by making myself irrelevant. So, how many of you are type A personalities and don't like to share responsibility, just want to do it yourself? Yep, it's hard sometimes, right? To ask somebody to help or to do something for you. Because if I ask, let's say, Devonna, you're my CNA, and I say, Mr. Jones has to get up for an appointment. He needs to be bathed. He needs to be dressed. He needs to be fed and out the door by 9 a.m. Who's overall responsible for you completing that task?
I
I'm sorry.
I would be responsible.
So you're responsible because I delegated it to you, but it's the nurse's job, right, to make sure that it gets done. And
You did say I was your CNA. Sorry, I
yeah,
missed that.
no worries. No, I knew what you were saying. So in some cases it's hard, right? What if, Devonna was running around and she had, 4 other residents that, had appointments that morning, and here I'm throwing another one at her, right? Or sometimes we feel like, maybe we're not as busy and this, our UAPs are all busy and, it can just, do something quickly. So it is hard in some cases to delegate. But one thing as leaders and as future leaders that you should, when we talk about, you know, um, elevating our staff, right, and empowering staff. As long as we are working within their scope of practice and our scope of practice, right, that's how you help to build a strong team. So again, what do you need to know? you need to know your scope of practice. Has everybody gone to their state boards of nursing and looked at the Nurse Practice Act to see what they are and are not able to do in their state of practice? Nobody has looked at their Nurse Practice Act. All right.
Yes.
Okay, so when you go to apply for your licensure, make sure that you look at your state board of nursing and you look at your Nurse Practice Act. How many want to go and do some travel nursing when they graduate? Anybody? Just one. So with travel nursing, it's not, if you're going to travel out of your state and go and practice in another state, you also, even with that compact license, right, will need to know the scope of practice that is allowed in the state that you're practicing in. So make sure that you go to your state board of nursing and you look and see what your scope of practice is in your state. You also will have to know what the scope of practice is to who you are delegating to. So whether it's the CNA, whether it's another UAP, it's really understanding what they're allowed to do as well. And that can be limited also by the organization that you are working at. So your state or your Nurse Practice Act is an overarching, but the organization that you may work for may limit that in some capacity as well. So for example, CNAs. CNAs are trained to do vital signs, right? Some places, some facilities may not, require CNAs or may not allow CNAs to do vital signs, right? So that may be something. So it's just super important that you look and make sure that you are delegating to the appropriate person the right task. You also have to know the condition of the patient. Can we delegate to a UAP an unstable patient? Right? They have to be stable, right? So we have to know the condition of the patient prior to delegating a task to that UAP. So go back and let's talk about that nursing process. So we know that the RN can perform all of the steps of the nursing process independently, right? What can the LPN perform independently? What steps of the nursing
Implementation.
Wound care, they can do wound care independently.
Okay, no, the nursing process. What steps of the nursing process can the LPN do independently?
Implementation.
Data collecting and implementation.
Very good. Data collecting and implementation. RNs, right? They do the initial teaching. They are going to work with more of our unstable patients. LPNs will work with stable clients with expected outcomes. And then the UAP are pretty standard. Anybody currently working as a CNA? All right. So do you get tasked very often, or do you just have a standard thing, like a standard routine that you perform throughout the day?
Regular routine.
Standard routine?
I have a standard routine, but I'm also delegated to do things like EKG and blood sugar sticks, etc.
Do you work in a hospital, Brooklyn?
Yep.
Okay. So it's going to depend on where you're working, right? As to what your tasks are going to be throughout the day. So here are the rights of delegation. So the right task, the right circumstance, the right person, the right directions and communication, and then the right supervision and evaluation. So again, when you are delegating a task, right, to a UAP, then you are overall still responsible to make sure that that task gets completed and it is done appropriately. So it does require you to go and follow up with that person that you delegated to and make sure that it was done. There's also reporting guidelines, right? So you're going to ask them, not only are you going to follow up, but you're going to make sure that they understand what the task is that that you are delegating to them. All right, so here's a question. Which of the following clients would the RN delegate to the LPN? So think about scope of practice and the rights of delegation.
3.
A 3-day-old chest pain, did you say 3? I'm sorry.
Yes, 3.
Okay. Very good. Why would we choose that one?
That's
That's
the only
other
one
three.
that's stable for the most part.
The other 3 are unstable, technically.
Very good. So the 3-day-old chest pain is a stable patient, whereas the the post-op client who just came out from the OR, right? They're not going to be stable. Your new admission from the ED is going to require that admission assessment, right? We don't know what the condition of that patient is. And then the client receiving an insulin drip. And obviously that's, they're going to need a little bit more attention. Good job. All right. Which patient will a health problem related to GI cancer? Which patient with a health problem related to GI cancer would be the most appropriate to assign to an LPN?
2.
A patient who needs enemas and antibiotics to control GI bacteria.
Yes.
Oh, yeah, very good. Yes, I should have hidden the whole slideshow. Very good. So I'm going to stop sharing for a second. So what are some specific tasks that we can assign to a CNA or to a CNA or nursing assistant?
Vital signs.
Okay, vital signs.
Helping a client to the bathroom or like feeding or changing.
Okay, so toileting, feeding,
Reposition
hydration.
the patient, reposition the patient, turning the patient
Okay,
if they're stable.
okay, very good. What else can we do?
Would they be able to collect urine specimens?
Urine, stool. Yes, ma'am. What else can nursing assistants do?
Weights?
Clean the rooms.
Yep.
Stock supplies.
Okay, so just basic cleanliness of the patient's room. But yes, they can do heights, weights, they can do INOs, they can do basic restorative skills too. So like your transferring, your positioning, ambulation, range of motion. Has anybody ever had, so my CNAs, has anybody done any restorative skills?
Yes, I was a restorative nursing assistant my first
Okay,
year.
so what are some things that you did?
Range of motions, like literally helping them
Walking?
walking with the walker, um, all types of stuff, like helping them with the ADLs.
So it's a little bit more advanced than just the additional, right, to what a, a CNA would do. It's a little bit more special training in order to be a restorative aid. So the restorative aides that I worked with previously, they had a combination. Some worked with therapy, some worked with activities, right? And they would do a combination to just, it's all about positioning and transferring the range of motion, how to use those assistive devices. Goal there too is to prevent pressure areas from developing, right? Those are, it can be devastating. All right, let's do another question. I hid the answer though. All right, so the assistive personnel reports to the LPN that a patient's urine output for the past 24 hours has been only 360 milliliters. What's the nurse's priority action at this time?
Number 4, contact and notify the healthcare provider immediately, because that's half the amount, right?
Okay, so number 4, anybody else? Very good. Contact the healthcare provider. What's the minimum amount of urine that we want per hour?
30 milliliters.
30 mls.
30 mLs per hour. Good job. All right. Which action should the LPN delegate to an assistive personnel for the patient with diabetes?
One.
Is it 236?
236
And 1.
and
I
1.
think one is, it depends on the facility, because all facilities don't allow UAPs to do the finger stick.
Okay.
Okay, maybe not 1 because it's saying every hour, so maybe there might be some more going on
236.
for every hour.
Okay, so INOs, measuring vital signs, and assisting for reposition. So 2, 3, and 6, is that what we want to go with?
Yes.
Good job. Good job. So yes, 2, 3, and 6. So like you said, the glucose every hour. We are not going to have the UAP assess for fluid imbalance, right? We're not going to have the UAP contact the provider. All right. 4 patients arrived simultaneously at the emergency department. Which patient requires the most rapid action by the triage nurse and LPN assisting to protect other patients from infection?
Three.
3. Anybody else have any?
2. 2.
We got 2 and 3.
Mhm.
All right. It is 2. A 5-year-old patient with a new pruritic rash and possible measles, right? So what do we know about measles?
Very
airborne.
That is
contagious.
airborne.
It is airborne, right? So we want to put them isolation, right? All right, so we're going to save some more questions. But what are some issues that could be potentially related to delegation?
Maybe like it depends on where you work. Not all facilities have the same rules as far as like what tasks UAPs can do.
Okay, so some may not have the same. Okay, you have to know what your facility protocol is, right, in order to delegate to a UAP. All right, What else? What are some other issues too that can be related to delegation?
Their actual
They might
skill
not be
level,
truthful.
experience level.
Okay, their skill level, their experience level. Somebody else said something.
They might not be truthful. Like if you ask them to do something and maybe they forgot, so they just make up a number to make it seem like they did.
Right? Because everybody always has a respiration of 18, right? Right. You're absolutely right. Or they may say that they went and did something and they did not do it, right? Um, if I were to go up to a UAP or a CNA and ask them to do something, do they have the right to refuse?
If they don't know how to do it, yes.
Okay. What would be, they can also, I mean, just like I was saying, if the CNA is already overtasked, right? They can refuse that delegate. They can refuse. I mean, it's always nice to ask why. They have to accept the task that you are assigning to them. So, if Devana already has 6 patients and she's trying to get up and get to appointments, and I try to add somebody else to her workload at that time, she can say, hey, I don't have time for that. Is there somebody else that can do it? Right? It has to be voluntarily accepted by the patient that you are that you are delegating to. And so this is something that you have to make sure that is accepted as well. So making sure that you're going to do your follow-up to make sure that they go back and they perform the tasks that you asked them to do. When you talked about giving you the wrong numbers, unfortunately, that can occur in any area. So what are some things that you would, let's say a CNA did that, reported back incorrect numbers or made up numbers. What would you do in that situation?
First, I would
You
ask them,
have
do
to
they
double
know
check.
how to do
I
it?
would go
Report it.
take the vitals myself.
You would take them yourself, Sahara. What were you
I
gonna
would
say?
double check, yes.
Double check.
I would ask them, do they know how to take respirations first?
Okay. So when we are using those rights of delegation, right? So when we look at those rights of delegation and we are assigning tasks, right? Yes, we are assigning tasks according to the Nurse Practice Act, correct? So it has to be within their scope of practice. However, we also have to make sure that they know how to do what they are doing before we assign that task, not after, right? So, excuse me, if we are going to ask them to do vital signs on a patient, we are going to make sure that they know how to do vital signs prior to them doing them. How do they, do they know how to take a pulse? Do they know how to take a blood pressure? Do they know how to count respirations? Right? So that is one way that we can prevent that misinformation from coming back. So when you delegate a task, in that delegation, in that discussion with that CNA or care partner or care technician, whatever it is, we need to make sure that they are clear with the directions and then they know how to perform that task. So remember that will help in some cases to prevent some misinformation that's coming back. At the same time, I mean, you will have to follow up. The goal for delegation, and it was a good example when you said that, I would just go do it myself, right? The goal of delegation is to relieve some responsibility, not relieve responsibility, but to help complete the tasks that need to be completed, right? So whether it's vital signs, whether it's turning and repositioning, whether it is emptying a Foley catheter or, you know, getting that glucose level, whatever it is, you know, kind of you're transferring a little bit of that responsibility to somebody else. And so the goal is for them to be able to perform the task independently and report back to you appropriately. If you have to go back and double check and recheck the vital signs, right, then we've kind of defeated the purpose of delegating that duty. In a lot of cases too, it's a trust that you will build with your UAPs that you work with, right? So again, some of you that are already UAPs or CNAs or care techs or med aides, right? You may, and you know, this is true in any situation, right? Not everybody always gets along, but you generally will have nurses that you work with that you trust, right? Or you may have that go-to nurse that you work with, right? That you have that good relationship with, right? Someone that you trust a little bit more than another. Maybe. Naya said yes. Okay. Right. And so, but that's the goal, is to build those relationships, right? To get that trusting relationship between you, your UAPs, so that, you know, they know what is expected of you and you can rely on them, right? When you ask them to do things. And so that is the goal of delegation. If we have to continuously go back and we have to recheck or redo tasks that were assigned, right, we're defeating the purpose, right? Then, you know, you're not saving any time by having to go back and follow up with every single thing. So what do we do in that situation? If I'm delegating tasks, I know that they know how to perform the task and they still refuse to report or refuse to perform the tasks appropriately. What do we do in those situations?
Tell the manager.
Tell the manager. What if you're the manager?
Tell the assistant manager. No,
Fire them.
Oh, hey, hold on.
Don't you
What
have
do
to
we do
address them
before we
about it?
fire them?
Address them about it to see like what maybe went wrong?
Ask them about it. Absolutely. Ask them about it. Is there a communication barrier or is it a disciplinary issue, right? What's
Can we
going
send them
on?
back to training? Like I know at hospitals they have like UAP training, like maybe send them back before
Right.
you fire them at least.
Right. We want to provide them a chance, right? To maybe they need additional education. Maybe they, you know, thought they knew how to do vital signs and maybe they really didn't. Maybe they don't know how to document. Maybe they don't know how to read, you know, the gradient lines on a Foley catheter bag or in a drainage device. So we do want to provide that education, you know, and give them a chance. Empowerment is key, right? I mean, that's the goal here is we're trying to empower, we're trying to split the duties, as well as, you know, increase effectiveness and efficiency on a unit. So these are some things that, you know, we can work through. And then, you know, whoever said it, I didn't catch who said it, but, you know, if it's going to be a continuous issue where they're not going to be able to complete their duty as appropriately, right? Then there is a, what's the word I'm looking for? A process, right, that needs to be followed, whether it's, you know, performance evaluations, that kind of thing. Generally speaking, unless they do something detrimental to hurt a patient, most are not going to, you know, get fired on the spot. There's usually a process that must be followed. So, but yes, but we need to do that. You know, again, we were looking at empowerment, we're looking at efficiency and effectiveness as LPNs who, I guess I know for some of my group, for what Dr. Tenz's group, who wants to go work in a hospital?
I do.
All right. What areas are you interested in?
I think we can only do so much. So like it's either ED or what med surge,
Okay.
ICU.
ED, med surge, ICU, anybody else have any preferences?
Same ED or med surg.
Anybody want psych? Psych,
Yeah.
yeah. Okay. No, some are yes, some are like, no. I'm
I
like,
wanna
I'm
do
not a
psych.
psych nurse. I'm not a psych nurse. Can't do it. Can't do it. Takes a very special person to work psych. So working in the hospital, right? Working with the UAPs in the hospital is going to be a little bit different, right? Than if somebody were to, you know, if you were working in long-term care. Anybody like long-term care? Nobody likes long-term care. In long-term care, the opportunity as LPNs is a little bit different than in a hospital. In long-term care, right? LPNs can be unit managers. I have seen assistant director of nurses. I have seen LPNs run assisted living facilities, right? So it really kind of depends on what you want to do and where you want to go. And so supervisory duties in long-term care as LPN are going to be a little bit more extensive than supervisory duties in a hospital situation. You still have UAPs that you will delegate. What are some of the legal aspects that we have to worry about when it comes to delegation?
Malpractice.
Malpractice, okay. So like I was saying earlier, when we were looking at delegation, when we look at some of the legal aspects following delegation, again, you're going to need to know the Nurse Practice Act for your state. You also will need to know what they are allowed to do based off of your organization as well. Again, the Nurse Practice Act is that overarching, right? This is all the stuff that you can do, but then your facility can limit that. They can't go above it, they can't go beyond, okay, but they can limit in some situations. Remember that it is your job prior to delegating that task that you know what the patient's condition is, right? What, you know, what is going on with that patient, making sure that they are stable prior to delegating that task. And making sure that you are giving them a task based off of their demonstrated ability. So Naya, right? You were the one that said that you were you worked as a restorative aide, right? So restorative aides are trained a little bit more as far as providing certain care to patients, whereas other nursing assistants are not going to have that additional training, right? So we're not going to delegate to a nursing assistant a restorative aid duty if they have not been trained in order to do that, right? So, and then as you work with your nursing assistants and your other UAPs, right, you're going to learn. Some are really good at certain, you know, at some things or a little bit better at some things. You ever notice that there's some CNAs that can charm even the grumpiest patients? they just have that power with them. They can just charm the grumpiest patients. And that's just an example, but you're going to learn as you work with them, right? What, their strong areas are, what their weaker areas are. And as a leader, right, our goal is to build them up, right? We can help them to increase their abilities. We also want to make sure that we're providing specific, objective, clear-cut directions, right, for those duties. So when we talked about, vital signs earlier, and we talked about not getting the right numbers or, making the numbers up, this is where we want to provide those clear objectives prior to them performing that task. So you want to tell them exactly what the task is that you need completed and exactly what you need to be reported back to you when it is done. If they need assistance, if they have questions, right, you want to make sure that you try to answer all their questions appropriately prior to them performing the task. Or even if they go to perform the task and something happens, they should be able to come back to you and ask you questions, right, to get clarification or to tell you if there's any concerns. We are there to monitor them, to make sure that they are performing the tasks appropriately, that they are documenting and doing what they are supposed to do. It shouldn't, if you've got, depending on where you work, if you have 6 patients in a hospital, you have, 60 patients in a long-term care facility, for 6 patients, it may be a little bit easier for you to go back and do, checks to make sure, that everything is getting done appropriately. But if you have a 60 bed unit in a long-term care and you have, quite a few CNAs, it may not be possible to go back and check on every single thing that was delegated, but you can do spot checks, right, to make sure. The goal is to build trust, right? And between you and your UAPs. If there is a situation that, somebody is doing something inappropriately, then the goal is to intervene. So we had a situation, I just learned of a situation that happened in a long-term facility where a CNA was using a Hoyer lift by herself and dropped the patient onto the floor. So, has anybody used a Hoyer lift? How many people are supposed to be? How many people? 2 people.
2.
Right? There's supposed to be 2 people when you use a Hoyer lift, especially for total, right? And so the CNA decided that she was going to use the Hoyer lift by herself. And it was a larger patient. And I, of course, was not there. I'm just getting the story secondhanded. But didn't spread the legs on the Hoyer lift when she was turning, and the Hoyer lift tipped over and he fell and the Hoyer landed on top of the patient, right? So this is times where, as a nurse, right, if you were to, see something like that, right, you want to stop that before it occurs. If if I ever saw a CNA with a Hoyer lift by themselves, I would just follow. Do you need some help? You got it. Just to make sure, because safety is key with our residents. What are some other safety concerns that we want to make sure that we are educating our UAPs about? What are some?
I just had a question. Does that still come back on the nurse?
So well, not necessarily. It depends on the situation. That is, it's not following policy and procedure. And that's a normal task that, that's a normal task that would be a CNA responsibility. So more so it will go back on the facility rather than the nurse. But again, it's making sure, right, that they're trained on the equipment, that they know what the rules, the policies and procedures are of the organization, right? And that those policy and procedures are being followed. Fortunately, the patient did not sustain any serious injuries. But enough that he had to be transferred to the hospital and then he was sent to a different facility. He was not sent back to the original facility that he was at. But if you see something like that, it is not okay to look the other way, right? It is something that needs to be, you have to intervene right away. But what are some other safety things? And think of your patient's rooms. What are some other safety concerns that we want to make sure that we are delegating appropriately?
Like clutters in a room, like maybe cleaning the room, making sure the floors is like nothing's on them, no cords or anything.
Absolutely. Clutter. Clutter will get you in trouble every time, right? Um, cleaning up the clutter. What else?
Bed in the lowest position.
Bed in the
Side
lowest
rails up if
side
being
rail.
turned.
Okay, so side rails are going to depend on where you work. So in a hospital situation, yes. And again, the side rails up, making sure their bed alarms are on, right? If they're not allowed to get out of bed. What else?
Proper room temperature, you know.
Room temperature. Absolutely.
Safety for the client or the UOP as well, or just the client.
Both. Both.
Proper body mechanics for the UAP.
Proper body mechanics. What's the number one nursing injury?
Back problems.
Back. Very good. So making sure that we're even nurses using proper body mechanics. Good job. What else? So we got clutter, we got bed in the lowest position, we got temperature.
Side rails or like a floor mat.
Oh yeah, we got the side rails, the floor mat. Okay.
Provide privacy.
Privacy. Okay.
Their call
alarm.
button.
The call button. Making sure that they have their call button. And that they have everything within their reach, right? They have their fluids, they have their remote control, their phone, whatever that is within their reach and accessible. You know, how many people fall out of bed because they can't reach their phone or they can't reach their water or something else that they are looking for and they're trying to lean over to get what it is. So think about some of these. And so when we look at safety, right, making sure that our UAPs understand, the effectiveness of that. Delegation, or I'm sorry, safety is going to always be one of the key factors, right? Even infection control as well, right? Making sure that the Foley bags, the O2 lines, that nothing is, touching the floor. And then once we have, they're trained, the task has been delegated. Again, we are going to do a follow-up. If you delegate a task inappropriately or improperly and a client was harmed, you as the nurse will be liable. And so that is something that we have to take into consideration. That's why it is so important, right, to follow those 5 rights of delegation. I'm trying to think of when, what that would be. if you delegated a task that was outside their scope of practice, if you delegate a task that they potentially are not trained to do, and there was a, an issue, resident was harmed as a result, that would be responsibility on you as a nurse for delegating that task. Does that make sense? So like with the Hoyer situation, right? Go in, CNA, your UAPs are trained on how to use Hoyer as long as they know what the proper policy and procedure, that's a normal task that they would perform. That isn't necessarily a delegated task. But if I'm trying to think of let's say, I'm trying to think of something that you would potentially, I don't know, if you delegate something that CNA or that UAP is not trained to do, and it is, there is a patient that was harmed, because you're going to be the one that's liable because you assign that task to that UAP. And that can result in disciplinary action. It could, be from the Board of Nursing. It could potentially result in civil suits as well. And that's why, again, following those rights of delegation is super important. If you delegate it appropriately, okay, and the client was injured, the nursing assistant is also liable. So if you so in that situation where the nursing assistant dropped the patient in the Hoyer, right, that nursing assistant would be liable as well as the facility. So there is, there's going to be a little bit of a difference there. If you're working in a situation as, in long-term care, you may not have an RN that's already available, but in a hospital situation, if you're working like a team nursing, where you have an RN, LPN, and your UAPs, always collaborate with that RN, right? And before you delegate tasks, that will help to make sure that we're delegating to, following those 5 rights of delegation and making sure that everything is delegated appropriately. Try to avoid those situations. Sometimes, it's not always, there's always going to be, a risk in some situations that we do have to worry about. But if you just follow follow those rights of delegation, make sure you know the Nurse Practice Act, then usually with delegation, it should, you should be good. So what are some tasks that we cannot delegate to a UAP?
Changing the catheter.
Okay, changing a catheter, right? So anything that will require any complex sterile techniques, a nursing assistant cannot do. What else?
Are they, so it's a debate out here. Are they able to change the colostomy bags? Cause I said no, they're not, but in nursing homes down here, you see it a lot. The
Where are you
CNAs
at?
doing it in Delaware.
Okay. So here in Texas, CNAs can change colostomy bags. So
Like
I
when you
think
say change them, do you mean like the whole total care, like replacing the patch and everything, or do you mean just like the bag itself and burping it
I
and
do
like
so they,
changing the
everything.
contents of that?
they can change the wafer as well.
Okay.
So yeah, so it is different. And so that's where that Nurse Practice Act comes into play, right? Because there are different regulations for each state. In some states, CNAs can also do tube feedings. So they can hang a tube feeding or give a bolus feed. Again, it just depends on what state that you're in. So that's why that Nurse Practice Act is super important. But yes, so sterile procedures, generally speaking, your nursing assistants, they don't have the training in sterile technique, right, in order to perform those. We're not going to, again, those crisis situations. I find it interesting. Raise your hand again if you're a CNA. I'm sorry. So does your facility require you to have CPR?
Yes.
So it is interesting that some facilities don't require their CNAs to have CPR certification. So that if a patient goes or something happens, right, they're going to get a nurse. Generally speaking, again, your nursing assistants are not going to, right, work with those unstable clients necessarily, right? If this patient declines, if something happens, they are going to go get the nurse, right? Nursing assistants also can't interpret data, right? So, it's just task oriented. So if you ask them to get a blood sugar, right, just report back the blood sugar or the vital signs, right? They're not, evaluating, they're not interpreting the data. They are simply collecting the data and then returning it back to the nurse. And then the nurse is the one that's going to determine what, the next step are going to be. So those are just some things that, when you're looking at delegation, those are just some things that we are not going to delegate. Can they provide education to their client, to the patients? Can a UAP, can they reinforce? They can reinforce certain things, right? I mean, not, they're not everything, but they can go in and they can encourage the, incentives barometer, right? If they see something with their diet, right? There's certain education that they can reinforce that has already been provided by the RN. So that is, they're they have that ability as well because they're, part of that nursing team and they should know what's going on with the clients in order to provide, just some reinforcement with certain things. All right, so let's take our second break. We'll be back at 4:10. All right, so we've talked about delegation. So let's talk about leadership. So,
Little bit of curry and salt. Add in some olive oil and mix it until everything is evenly coated like this. Now in the pan, we're gonna add in some butter. On that, and then
all
we're gonna.
right, somebody needs to mute. All right, so as LPNs, okay, you may have the opportunity, like I said earlier, depending on where you are working, you still need to develop leadership and management skills so you can direct and supervise others, right? And that's, so you can help to meet the goals of where you work, right? So we have leaders and we have managers. What is the difference between a leader and a manager?
A leader will get in and roll their sleeves up and work alongside of you and keep you encouraged.
Okay, I like that. A leader is going to jump in and help. Okay. Um,
And
so
leaders' concern is the overall, the organization as a whole.
okay, so the leader is more like with the organization of the as can't even say it, as a whole. Okay, what else? So leaders are more people oriented, right? They're about motivating. They, have a vision. They usually can develop a strategy. They inspire trust. One of the big things with leaders is they empower their staff or they empower the people that they work with. They are good at delegating most of the time. Um, and they're also good at, exploring goals as well as reflecting. Um, Leaders can, be formal, right? Like a person in charge, like your instructor, your dean of nursing, your supervisor, your manager, your director of nursing, whatever. We also have what are called informal leaders, right? What are informal leaders?
Like supervisors? Like shift
Supervisors are
supervisors?
formal.
Like
Those
a
are
team
formal,
lead or something?
right? It's that go-to person.
Shift lead.
Right? It's that go-to person, right? You have a group of people and, one, it seems to just be the one to take charge, right? That can, may not have a formal leadership title, but, um, people tend to follow them. Um, it's important for leaders to have followers too, right? So leaders have to um, be able to gain the trust of the people that are working for them and with them, right? Because if they don't gain that trust, then the leaders are going to fail. Um, leadership skills can be learned, okay? But you'll develop those leadership skills as you practice and as you grow. Managers, on the other hand, are much more task oriented. The focus of management is planning. They, should focus on collaboration, but a lot of times they're more into power and control. Managers are usually appointed by their employers. Um, and there are also management tools out there as well. They're, responsible for goal setting and for measuring those goals. So not necessarily good and bad either way, right? Um, but there, is usually a clear difference. So when we look at this, we have different types of leaders that are out there. And so we have different management styles or leadership styles that are out there. And so this is your autocratic, your democratic, and your laissez-faire style leadership. So generally speaking, your Democrat or your, can't even say the word, Democratic leaders, share responsibility. They balance concerns with tasks and employees. They, enforce policies but have concerns for employees. They also seek input from employees. They encourage problem solving. I'm trying to think of some other things. So democratic, thank you. They just kind of balance, right? They're in between. They, want employee input. Your autocratic style, they don't share responsibility or authority with the employees. They are more emphasis, more of their emphasis is going to be on policies. They don't seek input from employees. They kind of just tell people what to do. Their autocratic style, democratic style, is kind of nice when you're working with a group of people and you value their input and you're looking at ways to maybe, let's say, improve infection control or improve patient safety, or, collaborating on other things that need to be done. Whereas autocratic style is very, just task oriented. This is what I need you to do, which in situations like crisis situations, codes, emergencies, right? We need that autocratic style of leadership to direct people, right? To make sure that everybody is safe, everybody is doing what they need to be done. Laissez-faire, on the other hand, they basically give away responsibility and authority to employees. Employees are put first before policies. They're people pleasers. They try to get along with everybody. They don't really have, it's more of a really laid back style of leadership. Again, it may not even be, it's not any kind of a formal leadership style where, things are generally getting done. So when we look at this, so again, autocratic, they don't share responsibility. Emphasis is mostly on policy. They just give out tasks. They don't seek input. Um, Laissez-faire puts employees before policies. They try to please everybody, gives away responsibility, authority to your employees. And then again, democratic, they share responsibility, they share authority with employees, they enforce policies, but they have a concern for their employees. They like to seek input from their employees, encourage problem solving. So these are, the democratic style is really good with daily nursing care, meetings, committees, review care plans, that kind of thing. Has anybody ever thought about what type of leadership style they have or that they prefer? Has anybody worked with a leader that has been very autocratic, just barking orders, do this, do that, do the task, that kind of thing?
I have, but it didn't work out well.
It didn't work out well.
No,
Why is that?
I'm not that type of person to sit and handle someone barking orders at me, especially because I come here to my job, the same job every day. So I know how to do my job. I do it well. Don't bark orders at me. So that's just how it goes.
Okay. All right.
We
Has
all hate
anybody?
the micromanager.
Okay, so yeah, a lot of times they get that type of leadership style does feel like it's micromanaging. Absolutely. What about laissez-faire? Has anybody ever worked with a manager that's just kind of like, whatever? Yes. How did that go?
It doesn't go well either.
No. Does stuff
Especially
get
when
done
you
like
need to get something done or you're having a concern or a problem. Like it's just like it's not going to happen.
right? So most people prefer the democratic style of leadership, right? Where the input is sought from employees, right? Decisions are collaborated upon. Um, Employees' concerns are taken into consideration before things are done or changed, right? Um, and so each one of them, and most people or most leaders, most managers have a combination of leadership styles. And it just takes time to try, to develop your leadership style. And a lot of times we develop our leadership style based off of what we've experienced in the past, right? So, if you've worked for someone who's very autocratic, right, and it didn't go well, then you kind of know that that's not the type of leader that you want to be, right? Same thing with the laissez-faire, that they're just kind of laid back and relaxed, and they're trying to make people happy, but they're not meeting the needs of the organization, right? That's not necessarily a good style. But again, most people have a combination, and autocratic and your democratic usually are in some sort of a combination, right? Can work with employees, we can accept their input, but then in those crisis situations, or at the time, depending on the situation, right, then they may have to be more like, I need you to do this, this, and this, right? And so they kind of, vary their style accordingly. And that's what we call situation leadership. um you adjust your leadership style based on what the work environment is. So when we look at leadership, what are some responsibilities of leadership? Think about this, think about people that you've worked for, as managers, as supervisors, whatever. What are some of the goals of an effective leader?
Team development.
Team development, right? Absolutely. Team development, team motivation, right? They have to be, motivational, right, in order to get everybody to work together. What are some other areas that you should develop to be an effective leader?
Communication skills.
Communication skills are absolutely necessary. What else?
Being an advocate for not just your team, but for all aspects of the team, the patients, everybody.
Okay, advocacy skills. All right. What else do you think is important?
Being able to resolve conflicts.
Conflict resolution, problem solving. Okay. What about collaboration and building that team up? And another really big one is stress management. Healthcare is stressful, right? And so as a leader, as a manager, you're not only dealing with your stress, right? But you're dealing with the stress of the members of your team, right? So, how to handle that stress, and even how to help your employees and or to help your employees or your coworkers, right? To manage stress effectively as well. And that's a big part of it. So what do we do? How do we motivate people?
Offer incentives. Money will do that.
Money. Yeah, well, can't always offer money or pizza.
Build a rapport and maybe work alongside of them.
Build a rapport, absolutely. So, how do we build rapport? What are some things that we can do to help build rapport with our coworkers?
Team
Maybe offer
building.
like one-on-one meetings, weekly meetings with the team, or one-on-one meetings, like individual.
Okay, one-on-one meetings, right? So kind of like, the start, stop, continue, right? These are things that you're doing well. These are things that you're not doing well, right? That kind of thing. Okay, what else can we do? Someone said team building. What are some good team building things that we can incorporate?
Morning huddles.
Morning huddles. Oh, I love that. So what is so important about a morning huddle?
That's where you talk to them about everything that's going on. They tell you what's going on. You tell them what you want to be done, any changes in the patient's status, etc.
Okay. And so how does that build the team?
They know you're interested, like, in what's going on the floor and what they're dealing with as far as the patient, and that you're involved in helping in any way you can.
And including their input.
Right. So it's a way that we could also problem solve situations, right? Um, you know, just to kind of, to get different views all together. Okay. What are some other good team building?
Some places do like outings, like team outings, like bowling,
Okay.
dinners, and stuff like that.
All right. Some team outings. Nobody wants a pizza party? What about just, a simple thank you, right? Recognizing people for, and I know it sounds bad, but, recognizing them, saying, hey, you're doing a job, you're doing a good job, right? That kind of thing. People want feedback, right? We all want feedback, right? We want to know how we're performing at work, right? Are there things that we can do better? But simple thank you sometimes, right? Whether it's just a little thank you card, um, or some other small token. It doesn't have to be like, a big deal, but right, it's a big deal to the person, right? That they got that thank you card, or that somebody just pulled them aside and said thank you. So these are things that, when we look at as leaders, these are, what we want to make sure that we are building. What can we do as far as stress management for team building? How can what are some stress management techniques that we can do? I know it's always a hard one, right? So give me some examples. I'm going to say this. Give me some positive examples of things you do when you get stressed.
I go to the gym with my friends sometimes when they're not being lazy.
Okay, you go to the gym. That's a good one. Okay, what are some other ones?
I listen to
Just breathing or reorienting yourself to something different.
Okay, breathing. I heard someone say listen to music. All right.
When I went through
Going on
therapy,
walks on your break.
Therapy, walks on your break. Okay.
my therapist taught me grounding episode and a grounding exercise, the 5 4 3 2 1
Oh,
thing
what's
where five
that?
things you spot out 5 things that you can hear or see, 4 things that you can hear or see, and then you just cover all the senses basically,
Okay.
and the last one being touch. So like 5 things you can touch, or 4 things you can hear, 3 things you can see, 2 things you can taste, and 1 thing you can smell, or however, whatever order you want to do it in for the senses, just kind of to reorient you to what's going on, kind of bring you back down.
Okay. All right. So Lou said nursing and healthcare is a stressful environment, right? And so we're gonna have good days and we're gonna have bad days. And so, and I say positive, okay? So developing positive coping mechanisms is going to be key. If you don't have, not everybody has coping mechanisms, right? Some people don't know how to handle stress. But trying to identify some ways that, when you do feel stressed, what are some things that are going to work for you, right? Some people just need to walk away, right? Go and to the restroom, take a deep breath, um, you know, just walk away from the situation. You don't always have the opportunity to do that. Okay. But, we have to look at, what can we do to avoid any long-term issues related to stress? Because we know that long-term stress, high stress, right, is going to have negative effects on our body. At the same time, when we're looking at stress management, right, we have to look at it for ourselves, but we also have to look at, how do we help our patients with their stress? So as a leader or as a manager, what are some ways that we can create a less stressful environment at work?
Helping each other, working together so that person is not stressed from the workload as well.
Okay, absolutely. Work together. Um,
Being fully staffed.
be- who said that? I missed it.
Me.
Oh, Devonna. Okay. There's a dream. There's a dream, right?
Rotating assignment so that everyone's not getting the same person and stressed out this every day.
Okay, so organize the shift so that you can prevent some stressful situations. Absolutely. What about making sure that nursing assistants have the resources and stuff to be able to get their job done? So I know some of you are CNAs. How many of you struggle with the linen issue? Never have enough linen. There's never enough washcloths and towels,
The
right?
place I'm at now is pretty good, but not too long ago when I was agency, yeah, you can't get linen. Some facilities will take away the wipes, so now you're using washcloths. And sometimes you don't have washcloths, so you have to like soap up the paper towels. Yeah, that was bad.
I never could understand that. I never could understand that. Um, Personal hygiene, that is part of a lot of what we do, whether you're a CNA or a nurse, right? But making sure they have the resources. I remember taking students to clinical, um, and I would literally stand outside the linen room and wait for laundry to bring the linen in the morning so I can make sure that the students had linen to do their bed baths and stuff in the morning. So yeah, adequate resources. So, making sure that there's linen, making sure that there's wipes, that they have everything they need in order to do their job, that the vitals machines are working, whatever that is. What about taking breaks? How many times have we worked a shift and we didn't even get a break? what, or in more than, not more than 5 minutes to just go get a sip of water, from the break room, right? So making sure that people are taking their breaks that they, as they should. And creating a calm environment. So who's ever worked with a leader who is just high stress all the time and just seems to bring chaos with them wherever they go? Anybody ever worked with somebody like that?
I got one now. She's
no.
like high anxiety and it's just like, calm down, everything's okay. Like if anything go wrong, someone falls, she tries to like point the blame so that she kind of shifts the blame off of her with her big bosses, but no one's at blame. It's just her anxiety. It's crazy. It's her anxiety.
So with people like that, that increases the stress on the unit, right? Or with everybody else. Everybody else is going to start to feel that anxiety. So as a leader, trying to remain calm is hopefully will come to bring a calm environment to the rest of the unit. And then treat your nursing assistants with respect. And so some of you are already nursing assistants, you're going to be nurses, so you know what it's like to be a nursing assistant. You know what their job is like. It's hard. And so treating them with respect, they deserve respect. I will tell you, CNAs are very underpaid for the job that they do when working with our patients and our clients. And so, treating them with respect, understanding that their job is difficult, as is a nurse's job. But again, making sure that, you know, you're treating them with respect because they do deserve it. And I'm not saying you have to, bring them donuts every day or anything like that. I'm just, be respectful and treat them appropriately. I love my CNAs. I don't know what I would do without my CNAs. And so I will get down in the trenches with my CNAs because their job, like I said, their job is hard. And so, just think of the experiences that you've had. All right. And so as you move into your role as a nurse, and potential in a leadership position, because like I said, regardless of where you are going to have oversight of your UAPs. And so think of your experiences as an employee with some of your supervisors and your managers that you've had. And you're going to kind of take take all of that into consideration. That's how you're going to develop your leadership and your management skills. You don't always have to stick with one. You can change your leadership style, right? Depending on the situation and sometimes even depending on the person that you were dealing with, right? So those are, and then, like I said, if you take all that into consideration, just remember how you want to be treated, right? And that is going to help you as you move forward. All right, so let's do some more questions. Share my screen. All right, so the LPN is caring for a patient with osteoporosis who is at an increased risk for falls. Which intervention should the nurse delegate to assistive personnel?
Is it
Four.
4?
Yep, assisting the patient with ambulation to the bathroom in the halls. Why wouldn't we have them identify environmental factors that increase the risk for falls?
Not
not
within
their
their
job.
scope of practice.
Correct. That's not within their scope of practice. Now, the more experience they have, right, they may be able to look around and make sure that the room is not cluttered and things like that, right? But that's not within their scope of practice, right? Can they monitor their gait, balance, and fatigue level? So they can't monitor it, right? But if they do, right, if they are assisting the patient with ambulation to the bathroom and in the hallways, right, and they recognize that something is wrong, right, they should report that back to you, right? All right. The charge nurse observes an LPN, LVN assigned to provide all of these interventions for a patient with Paget's disease. Which action requires the charge nurse intervene?
Number 3, we don't apply ice and massage the patient's lower extremities.
Very good. We do not apply ice and gentle massage to the patient's lower extremities. All right. So I have more questions, but I can't share my screen for these. All right. So what is priority when we are going to delegate? What are some of the priorities when we are getting ready to delegate?
If they know how to do the task.
Okay,
Make sure it's in their scope.
Yep, right. We're gonna check the Nurse Practice Act, right? Awesome. What else? Which leadership style focuses on task and employees?
Democratic.
Very good, Democratic. Very good. Let's see. So, oh, I didn't talk about this. So I know nobody raised their hand to say that they wanted to go into long-term care, but they have opened up. There are certifications that LPNs can get. So IV certification, if anybody is interested, IV certification is something LPNs can get. You can get certification in long-term care, if you want to be a geriatric nurse, or wound care. Anybody interested in wound care? I love wound care. I love wounds. I don't love the fact that patients get wounds regardless, whether it's surgical, pressure, whatever. I don't like the fact that they get them. But when they have them, I love working with wounds. Other things that, those are some certifications that LPNs can get. Other things that you can do to help, taking leadership courses, making sure that you're doing your in-services, join some of your professional organizations that will help to keep you up to date. They also have things like seminars and stuff that you can attend, whether it's live or even recorded seminars. So just to kind of help as you grow into practice. But again, like I said, in long-term care, you can, go into a leadership position. Who's going to go back and go on to school when they're done with this program? Those RNs, the BSNs, the MSNs, who wants to be a nurse practitioner? Like some hands went right back down. Anybody want to get a master's degree and teach? What? Nobody wants to teach? I said that too, though. I never thought I would ever be a teacher. All right. So no nurse practitioners, no teachers. Who's gonna at least get a master's degrees? Maybe. All right, Mira, Naya. All right, Brianna. All right. We got a maybe. All right. Who wants at least the bachelor's then? Go for those bachelor's degrees. Okay. All right. All right. Cool beans. So once you get into, and this isn't part of it, but once you get into an organization, a lot of places now, which I think is really cool, they didn't offer this when I first graduated, but a lot of places will offer you help with your student loan repayment. There's also places, of course, that will help with tuition reimbursement or tuition assistance, right? If you work there for a certain amount of time and you promise to work there for a little bit more time, they will offer you assistance with tuition. So those are some things to look into as well once you start working. All right. So so we talked a little bit about change of shift. What are some information that we will transmit during change of shift reports?
Like vitals.
Okay, vital signs. What else?
Background or any new changes that happen over the shift.
Background, any new changes that happen during the shift, right? Okay.
I would say any orders that's placed, like nutrition, like if they're NPO, any restraints in place, stuff like that.
Awesome. Yep. So we want any new orders, right? Any new problems, all of that. Any PRN medications. Very good. Any changes with our patients. And we're just going to go back and just because this is just reviewing. So what are some things that we can delegate to our UAPs?
Vital signs, weight,
Ambulation, changes, feeding,
bathing,
bathing.
Repositioning.
Bathing, repositioning, absolutely.
Bulletin,
Okay. Measuring inos, vital signs, right? Heights, weights, fall prevention, infection prevention. They can get, urine, stool collections. Can they provide initial education? They provide education?
no.
No. Very good. All right. What else? What are some things that we are not going to delegate to our UAP?
Wound care.
Okay.
New admissions.
Medication
Yes.
administration.
Sterile, anything
Okay. That was funny. So, right, those sterile techniques, right? So nothing that's going to require a sterile technique. They can collect data, right? But they can't make decisions about or interpret the data, right? So they're just going to provide you feedback with what they have obtained. Oh, I have an idea. I have a question. So everybody, those of you that have been in a CNA or are a CNA. All right. So let's say you get a brand new CNA, fresh out of CNA school, just got her certification. What are some things that you want to discuss with that CNA?
Understanding that nurses get really busy and they shouldn't take it personal.
Okay. Nurses get busy, they shouldn't take it personal. Okay.
Explain their roles and what they're gonna be doing.
Explain the policies and procedures and what they are going to be doing and what what is expected of them, right? They are going to go through orientation. That's, 100%, but that is absolutely true. Also, right? What do they know? Where are they lacking? Right? What is their understanding? And making sure, again, that's all going to fall back on that policy and procedures so that we can make sure that they, don't go outside of that scope, right? Don't use that Hoyer lift by themselves. Actually, and I talked about the gentleman that we dropped from a Hoyer lift. We also had one. I used to run a CNA program a long time ago. And we had a CNA, she had finished the program. She had not passed her boards yet. So she hadn't taken her exams. She didn't take the written or the hands-on part yet. So she was working in the facility prior to taking her test, and she decided to use a Hoyer lift by herself and dropped a patient. Fortunately, that patient, when she dropped that patient, landed on the bed still. But the Hoyer still landed on top of her. And so it was reported to the state, and she was not allowed to get her CNA certification. So she wasn't allowed to sit for her exam or get her certification, right? So we do have to make sure that they understand, even though they've been to school, right? They've gone through the CNA programs and they understand, what their role is. We still have to follow up and make sure that they are still acting within that scope of practice, right? So it can still be an issue that we may have to work with. Let's see, just making sure we covered everything. When we're evaluating, oh, sorry. When we are evaluating our CNAs or our UAPs, what are some things that we are evaluating?
That they can complete the task efficiently.
Okay, that they can complete their tasks efficiently. Making sure that they know how to document what they are doing or what they've done. Right? So making sure that they have all the resources that they need. All right, any questions on delegation?